breathing labor, possible allergic reactions.
He didn't eat or drink anything out of the ordinary.
The child has respiratory distress and it's worsening, so it's important to act immediately as the child is unable to breathe. One of the things to rule out if a child has respiratory distress is foreign body aspiration, as the child can put anything in his mouth like a small coin or a button battery or a Lego block, and it can get lodged in the air passage, which can lead to respiratory distress in children.
Where are you from?
Norway?
Center stage. Your son has a collapsed lung. We're going to help him.
How could you know that?
If a Norwegian kid can't breathe, it's a pneumothorax. It's a genetic predisposition.
I don't know whether Norwegian children are predisposed to pneumothorax or not, but the thing that I know is if a doctor is working in a geographical area for so long, then he will be knowing the diseases that are common in that area, as well as the genetic disorders which are prevalent in that population. So in these situations, trust your doctor.
Someone run another IV for me, please.
I'm all out of nurses.
Oh, I got it.
My girl.
Okay, watch his head.
Okay.
Back him up, back him up.
Ready out here.
Okay.
Slow, slow, slow. What's your son's name?
Basti, short for Sebastian.
Okay, Basti. Thank you.
So talking about this case, it needs a quick history from the patient's parents to rule out certain conditions like foreign body aspiration, asthma, any kind of chest trauma the child had, or any kind of cardiac disease that the child is suffering from, and then a quick examination to diagnose pneumothorax. So, pneumothorax is a condition in which air gets collected around the lung in the pleural cavity. So, this air pushes the lung, which puts pressure on the lung, causing collapse of the lung. Now, the lungs cannot expand and the patient cannot breathe.
Come on, guys.
Look at me. Step it out, step it out. You're going to be all right. We just need to let a little air out of you.
So the findings that helps us to confirm that it's a pneumothorax include a sharp pleuritic type of chest pain on the side where pneumothorax is present, fast breathing. On percussion, there will be hyperresonance note on the site of pneumothorax, and on auscultation, there will be decreased air entry on the side where pneumothorax is present. Imaging like an ultrasound scan can pick up this condition by confirming air in the pleural cavity, and if the patient is stable, a portable chest x-ray can be done to confirm the diagnosis.
Transplant team just took Ariel's father upstairs.
Understood. We're going to put a tube
Can I have a gel, please?
into Basti's chest to relieve the pressure. This is very routine. We can do it right here.
So once diagnosis of pneumothorax is confirmed, we can discuss the management of this condition. So first we need to manage the airway breathing and circulation. Then we need to continuously monitor the vitals, start the patient with oxygen inhalation. And now if the patient is breathless and a chest tube is not available, the patient is in a peripheral hospital, so we can do a needle thorax. So in this procedure, a wide bore needle such as a 16 gauge needle is inserted into the chest wall until it reaches the pleural cavity. It's usually done in second intercostal space in case of children, and in fifth intercostal space in the mid-axillary line in case of adults.
I'm looking for my diploma to make sure it's really my name on it. I'm prepping a tray for you. You're going to be making an incision.
Yeah, and I can take this case. Go on.
It's an emergency procedure which lets the air out of the pleural cavity and lets the lung expand again so that the patient can breathe. We can replace this needle with a chest tube. So once air around the lung is removed, the patient can breathe and the patient stabilizes. What I need you to know is that putting a chest tube in case of pneumothorax or doing a needle decompression in case of pneumothorax is not therapeutic. It's just to stabilize the patient, as it's important to save life first in an emergency condition like this. It's important to let the doctor thoroughly investigate you after this condition, as we need to treat the underlying condition so this condition do not occur again.
Let's go. Get this out of my way.
Stabilize the snake. Tube is in.
Vitals are dropping. Doesn't make sense.
Why isn't it working?
What is happening, please?
Might be a bad chest tube.
How many near the chest of plate?
You gotta get him ready for that.
It's not the tube. This one's just stuck. Coming up like that. He's breathing down.
Please do something. He's not breathing.
Inget.
Stuck infection. Get him out of the way. Grab the tool. You need to pull.
We need to get a doctor in here. I'm a doctor, and you are too. Listen to my voice. Do you feel it?
Yes.
Just stuck in the fatty tissue.
Okay.
So we just pull gently.
Good chest rise. Good job, Dr. Your little boy's gonna be okay.
I need a 3 nylon. Some inclusive dressings. Thank you.
Thank you so much for listening. I'm Dr. Rishabh Goswami and hope you gained some knowledge with this video. My efforts will be successful even if you can identify in which condition you need to transport the patient to the hospital early. So thank you so much, and please subscribe to my channel for more such videos. And please share this video to the people whom you think you care about.